Congratulations on your new braces! Dr. Geddes and her team are so happy to be part of your orthodontic treatment. You're on your way to having that beautiful, healthy smile that you've always wanted. But in order to get there, we need your help in following a few simple instructions. Good luck, and we know you'll do great. Now, let's get started. So now that your braces are on, let's review your home care kit, which includes a few things to help you take care of your braces. There's a toothbrush, floss and floss threaders, a proxy brush, wax, and an instruction sheet. Okay, now down to business. And let's start with how to brush your teeth with braces. You'll move your toothbrush in a circular motion and turn it in 3 different positions: the top of the braces, the bottom of the braces, and the front of the braces, spending at least 10 seconds in each position. So start with the top of the braces and brush down on the top of the braces with just enough pressure on the brush to get the tips of the bristles under the wire. Brush from one side to the other several times, and then move on to the next angle. Next, brush up underneath the braces, again putting just enough pressure on the brush to get the tips of the bristles under the wire. Brush from one side to the other several times before you move on to the next angle. Lastly, brush directly on top of the braces and wire, repeating the same motion several times. Remember to gently brush the gum line too. That's where your teeth and gums meet, and doing that will help those gums from getting swollen during treatment. Don't forget to brush your chewing surfaces and the back of your teeth. You'll need to brush for at least a total of 2 to 3 minutes each time in order to make sure that every surface is clean. It is important to brush your teeth at least 3 times a day or after every meal. Okay, let's go over how to floss with your braces. You're actually going to need to thread the floss under the arch wire. So to help you do that, you can use what's called a floss threader. Start with about 18 inches of floss and pull 3 to 5 inches of the floss through the loop at the end of the threader. Now, thread the floss threader under the arch wire and gently go between your teeth, hugging the sides of each tooth. Then just remove the floss and keep going around in between every tooth. Another option you have is using a dental floss called Super Floss, made by Oral-B. This type of floss has a threader attached to individual pieces of floss. It is a bit more expensive, but it can save you some time. You can find this brand at your local drugstore. Next, let's talk about your proxy brush. You can use it between the arch wire and the braces to help loosen food particles, remove plaque, and stimulate your gums. To use it, just push the brush gently under the arch wire between the brackets. Now, if it's hard to push the brush into an area, don't try to force it because you might accidentally break a bracket. So only use it in those areas where you can be sure to use it gently. And remember, it's important that you visit a family dentist at least 2 times a year for dental checkup and cleaning while you're in braces. This will help make sure that you haven't missed any spots and that your teeth stay healthy during your treatment. Okay, now let's talk about wax. As you're getting used to your braces, you might feel some sore spots on the inside of your cheeks and lips. And if you do, you can use orthodontic wax to cover the area that's bothering you. Just pinch off a small piece of wax and soften it by rolling it between your fingers. Then just place the wax over the spot that's bothering you. Just remember to take the wax out before you eat or brush your teeth. But if you don't and you accidentally swallow some, don't worry about it. It's not harmful to you. As a normal part of your orthodontic treatment, you might also experience a dull, achy sensation after getting your braces on, and maybe after each adjustment appointment too. If that happens, you can just take Tylenol or whatever you normally take for a headache or muscle aches, and you should be fine. If you have any soreness from your braces rubbing on the inside of your cheeks, you can use the wax, but you can also use a warm, saltwater rinse to help. Just dissolve 2 tablespoons of salt in a cup of warm water and swish. And you can also use Orajel to rub on that sore spot, and that'll give you some relief while you're getting used to your new braces. Okay, so accidents can and do happen. If at any time you do happen to break a bracket, band, or wire, it's not a big deal or a reason to worry. This usually will not cause any pain or discomfort, so we can put that bracket back on the next time you come in. Please be sure to save any brackets and bring them into your next appointment. Sometimes the wires can become a little long as the teeth move and align, especially in the beginning of treatment. Try to use the orthodontic wax first. As we explained before, this usually helps a lot. If even with the wax in place the discomfort persists, you can give us a call to book a quick appointment and we will clip that pokey wire for you. Okay, lastly, we need to talk about a few things you shouldn't eat while you're in braces. Eating hard, crunchy, or chewy foods can damage your braces. We ask you to avoid eating things like hard nuts, meat on bones, ice, or very chewy foods like caramels, toffees, and gum. As mentioned, these types of foods can and will damage or break your braces, which can add time to your treatment, meaning you could end up having your braces on longer than estimated. Another good tip is to be sure to cut up your fruits and veggies into bite-sized pieces and just put them into your mouth instead of biting into them. But the good news is, there are a lot of great treats that are okay to eat during your orthodontic treatment. Softer foods like plain chocolate bars, Reese's Cups, Hershey's Kisses, cakes, pies, and soft cookies. Just remember, a lot of these treats are really high in sugar, so you need to brush really well after you eat them. So, there you go. That's it. Everything you'll need to help you through this exciting journey of orthodontics. Congratulations again. We know you'll do a great job. And feel free to give us a shout anytime if you have any questions or concerns. Thanks so much for choosing Dr. Geddes and her team for your orthodontic treatment. We look forward to seeing you at your next appointment. Take care.